Welcome to Nursing Edge Unscripted Saga, where we use stories to connect the past to the present and then our future as we reimagine our teaching and learning. As we celebrate the NLN Year of the Nurse Educator, we pay tribute to extraordinary nurses who've made significant contributions to nursing education. We dive into the stories of nurse educators who recognized a need, challenged traditional customs, and influenced transformative change. Over the past 2 months, we have focused on the contributions of Dr. M. Beavis, Dr. Nancy Diekelman, and Dr. Pamela Ironside, educators and thoughtful innovators and scholars who played a significant role in the National League for Nursing's educational reform effort, the Curriculum Revolution. This occurred in the late 1980s and 1990s. These revolutionaries called for a transformation in the design of nursing programs, for a revolution to change the student-teacher relationship. In the humanistic educative model offered by Dr. Beavis, curriculum is defined as interaction between teacher and student. Therefore, in this view, the teacher-student relationship is the curriculum. A phenomenological model offered by Drs. Diekelman and Ironside called for a transformed relationship between teacher and student to open the possibility for learning from one another through meaningful dialogue. This month, we celebrate one of the most influential leaders of the NLN Curriculum Revolution, Dr. Christine Tanner. Nurse educators today may know Dr. Tanner as the scholar who conceptualized and developed the Tanner model of clinical judgment, a model used extensively today in nursing programs to teach thinking like a nurse. But for those nurse educators who recall the exhilarating days of the NLN Curriculum Revolution, Dr. Tanner's presence, her generosity and kindness, and her thoughtful and reflective publications deepened our understanding of the limits of traditional pedagogies and opened new possibilities for the ways in which nurse educators educate our students. In 1987, Dr. Tanner helped to organize the first NLN Conference to proclaim that a curriculum revolution was underway. Over 400 nurse educators gathered in Philadelphia with Tracy Chapman's hit song, Talking About a Revolution, playing overhead. Speaker after speaker detailed the compelling reasons for a major transformation in the what and how of nursing curricula. Not surprisingly, the call to revolution was not embraced by everyone. In Dr. Tanner's words, quote, "As one of the so-called revolutionaries, I was accused of being an overgrown hippie who now in midlife had attained a privileged position as a tenured faculty and a safe haven from which to call for a revolution. And still looking for an institution to overthrow, we had focused on the nursing curriculum. Our milder critics simply cautioned us to not throw the baby out with the bathwater," end quote. But clearly, momentum was gathered at those early meetings for a major transformation of what counted as an acceptable nursing curriculum. For many nurse educators who cautiously embraced the NLN's invitation to reconsider both the issues in the healthcare system and the dilemmas encountered in teaching students to think in context, there was a sense that something important and exciting was happening. Although not fully understanding the new pedagogies, they chose to join the revolution. Again, in Dr. Tanner's words, quote, "We of the hippie vintage proposed a resolution unanimously passed at the 1989 NLN convention calling for curricular innovations, which, if fully realized, would have revolutionized nursing education. 1. enhancement of caring practices through faculty-student and faculty-to-faculty relationships that are egalitarian and characterized by cooperation and community building. 2, social values that recognize the multicultural, multiracial, and growing diversity of both individual and family lifestyles in our society. And 3, learning experiences that incorporate analysis of present and future health needs for the population as the basis for transforming the healthcare system, end quote. Dr. Tanner's excitement for the possibilities unfolding at the early conferences was contagious. She led the charge, knowing that the revolution was heralded by some and marginalized by others. In part 2 of this series, we will explore how Dr. Tanner helped nurse educators come to terms with the conflicts and contradictions that educators felt in teaching nursing, how she shaped new ways to educate caring and critically thinking nurses to safely practice nursing. Dr. Tanner's leadership brought together a community of nurse educators committed to a new worldview of nursing's educational practices. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.